Hi there, we're here with Gergana. She's a member of our patient advisory board for the Answering TTP Foundation. And I just wanted to ask you a little bit about your story.
I was diagnosed with TTP 6 years ago. I remember laying in the intensive care at the Toronto General Hospital, and I had to battle for my life for about 6 hours, 5 hours and 40 minutes to be exact, because they could not put a central line in me due to my collapsed veins. I remember hearing one of the apheresis nurses begging the physicians to try again, and I remember hearing her saying, we're gonna lose her unless we get the line in and she gets her life-saving treatment. I'm saying it was a battle because my first symptoms began probably 3 to 4 weeks prior to I started seeing petechiae all over my body. I had bleeding gums, I was constantly tired, slept probably 13, 14 hours a night. So I went to see a physician at a walk-in clinic. It took me about an hour to get him to do a normal blood test because he was convinced that the petechiae on my body was simply an eczema, and he was prescribing a topical steroid cream for that. I did manage to convince him to get my blood work done, and I went to just a lab, got my test done, and just went on with my life as normal. Thankfully, that very same week I had an appointment with my dermatologist for a completely separate matter that I had scheduled months in advance. And when I was calling the walk-in clinic to get my results, I could not get in touch with anybody. They were simply telling me, we don't have any results for you, and I was a little bit frustrated by this, so I ended up calling a lab and asking them to fax my results over to my dermatologist that I was about to see that week. The moment I stepped into her office, she just looked at my chart, looked at me and asked me how did I get there, and showed my platelet count of 7. She explained to me that it was an urgent matter, that I go into any emergency room and don't wait for them, just show them my blood work results, and would go from there. I was a little bit scared because I knew what that could mean. So
You knew that the low platelets were dangerous.
Exactly, were representing possibly internal bleeding, who knows what. So I ended up going to a major treatment center in Toronto, St. Joseph's Hospital, where in the emergency room they were unable to diagnose me and they sent me home that very same night. I did not receive a satisfactory answer from them. I did ask, how can you send me with a platelet home with a platelet count of 7? What if, do I just go about with my normal life as I usually do? And they said yes.
Because a normal platelet count is over 150.
Over 150, exactly. So, and I had done my homework, so I knew that. I went home and I started calling friends and family who were in the healthcare industry and asked, where do I go to get a proper diagnosis? And they encouraged me to go to University Health Network. So that very next morning at around 8 a.m. I was at Toronto General's emergency room. About 9 hours later I was diagnosed with TTP, and after going through this whole ordeal and fighting for my life to even get a simple central line in because of my collapsed veins and because the condition had gone to that stage, I remember the very next morning being so thankful for my life and thinking how many others out there that have gone through the same experience, however, were not as fortunate. I started reading numerous research articles about the condition, and I was getting more and more frustrated by the fact that I was laying in the hospital and I was realizing how little it's known about the condition in terms of research and about the awareness because I went through this whole experience of going through a major health center in Toronto, not a small city, where I was not able to be diagnosed. And I could have died if it wasn't for my own gut feeling making me look for answers elsewhere. And I'm glad that I was able to meet other patients and share my story and hopefully raise awareness and stress on the importance of early diagnosis, and hopefully we can save more lives that way, because going through all of this, I know, and I've met a lot of supporters for TTP who have lost other loved ones just because of the fact that the condition was not diagnosed on time.
It's a rare condition, and so part of Answering TTP Foundation's mandate is to raise awareness not only with the public, with potential patients, but also with healthcare professionals as well, so that we can aid prompt treatment for this disorder.
Exactly. As part of the patient advisory board of Answering TTP Foundation, I've made it my personal goal. One of them is to raise awareness, number one, with the healthcare professionals, because they are the people we go to, and most patients don't have enough knowledge to ask and go elsewhere and ask for those answers. Most patients just trust their physician 100%, and that's how it should be. So it is really important to raise awareness both in society and in the healthcare world.
Gergana, thank you very much for sharing that story with us, and thank you for your involvement with the foundation.
You're welcome.